muscles go into spasm and that pain gets worse. So one thing leads to the other.
Pediatric headache is not uncommon, and I've seen headache in children from 2 years onwards.
And when you're in a state of fear, you're already in a state of anxiety and stress.
Ladies and gentlemen, welcome to an insightful discussion on managing pain and chronic illness. Today, our esteemed panel of experts will delve into the profound impact of chronic pain on patients' well-being and explore effective multidisciplinary approaches to its management, emphasizing the crucial role of patient education. Let's warmly welcome our panelists. Dr. Bashir, cardiologist; Dr. Amna Ila-Din, psychologist; Dr. Shanaz Ibrahim, pediatric neurologist. To commence our discussion, let's address our first question. How does chronic pain affect patients' overall health and well-being?
I think obviously chronic pain, just like the chronic stress, has impact on obviously different parts of the body. Depends on where you have the pain. And this again, the pain, whatever symptoms you have, there are a lot of like chemicals released in the body that eventually actually makes a vicious cycle. One thing leads to the other. If you have a pain, like some people have back pain, and then due to the back pain, their muscles go into spasm and that pain gets worse. So one thing leads to the other. So obviously if you have pain, let's say in the heart or chest pain, that can make things worse, and obviously there are secondary symptoms related to pain. Similarly, if you have joint pains, that can really cause problems. Your ability to walk is decreased, and if you are not able to do any exercise or any walk, that puts you on at risk for multiple diseases like high blood pressure, high cholesterol, diabetes, heart disease. So again, all these things are kind of interrelated, and one can lead to the other.
So a constant pain will not let you function. It's a constant reminder that there's something wrong with you, be it a neck pain, be it headache. Pediatric headache is not uncommon, and I've seen headache in children from 2 years onwards. So migraine is also not uncommon. And headaches, so for me, pediatric pain, if you're talking about, unless there is a chronic problem which is related to trauma or something, is mainly related to headaches. And headaches so you need to understand the aggravating factors for the headaches and try to resolve that. Counseling, and we need a lot of psychological support for these children, and even pain management requires psychological support.
I think the chronic health, what chronic health creates is a sense of fear, and when you're in a state of fear, you're already in a state of anxiety and stress, and that is what pain does to us. It creates fear, and fear creates all sort of negative emotions in us, and we lose resilience, and thus we experience more stress and more anxiety. So it's a cycle that you need to be careful of.
Thank you for outlining those significant risks. Now, let's delve into our second question. What are the most effective multidisciplinary approaches to managing chronic pain?
Again, I think I just discussed about that also earlier too. Basically, multidisciplinary, obviously different specialties have to get involved. The primary care physician, the psychologist, psychiatrist, and similarly you can have a rehab specialist or physiotherapist and dietitian. So all these people can work together to basically help you to reduce the overall stress and pain, which is going to help you to improve your overall health condition.
So as I said, you need psychologist, you need a good pain management team. Recently, I had a child coming in with a very severe pain in the arm, which was there for the last 1.5 years. The child wouldn't let you touch the arm, and it was a neurological disorder where the nerves were affected. And effective pain management helped the child. And I saw the child again after 3 months, and the pain resolved and the movements got better. So pain management is a very highly specialized field, even in pediatrics, depending on the pathology. And you need to understand that pain is pain is a factor in a lot of disorders.
So I think there can be so many. In the modern world, we talk about their medicines through which we can take care of it, their therapies, and when we talk about therapies, there's so many different type of therapies. Right now we have modern sort of therapies, which is EMDR and other sort of therapies which help people, facilitate. There are also so many other effective pain management therapies that are going on in collaboration with us. So I feel like if you want to really take care of yourself, you have to make sure that you're taking a holistic approach than only picking up one thing and working through it.
As we conclude our discussion, let us recognize the importance of a multidisciplinary approach and patient-centered care in effectively managing pain and chronic illness. By addressing the physical, psychological, and educational needs of patients, we can strive towards improving their quality of life and well-being.